Ask Your Pharmacist is brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals, quality healthcare. With support from VitC-Fort, your best vitamin C plus zinc supplement from Samu's Pharma.
Welcome to another exciting education on Ask Your Pharmacist. This is the only health show that provides you with all the needed education on drugs, medications, and health and wellness. I like to say that Ask Your Pharmacist a week keeps the doctor away. My name is Peggy Sano, and you can find me on Instagram at FieryPeggy. Remember that this show, Ask Your Pharmacist, is proudly brought to you by Dragnet. Dragnet is your #1 online pharmacy. Download the Dragnet app on the Google Play Store or the App Store. Order all your medications. Speak to a pharmacist, and wherever you are, Dragnet will deliver to you. Dragnet, your #1 online pharmacy. This show is also brought to you by the Pharmaceutical Society of Ghana. Amicus Humani Generis. Pharmacists are indeed friends of the human race. This is also brought to you by Letta Pharmaceutical with Letamin. Letamin is a multivitamin mineral supplement for total strength and vitality, promotes mental performance, and boosts the immune system. Folaron Zinc, on the other hand, is a folic acid, iron, and zinc supplement that effectively reduces the risk of iron deficiency, supports immunity, and promotes health and wellness. Letamox is a single-dose dewormer for treating intestinal worm infections and helps to increase nutritional uptake. Letamin, Folaron Zinc, and Letamox are all available in any pharmacy near you. For bulk purchases, contact Letta Pharmaceuticals on 030-222-4613. Letta Pharmaceuticals, quality healthcare. The show is also brought to you by Bell Beverages. Bell Beverages, refreshing the nation. This is also brought to you by Tema Christian Eye Center. Tema Christian Eye Center is the best and advanced ultra-modern eye care facility with skilled and experienced doctors with exceptional customer service. You can locate them at Tema Community 1, adjacent the St. Paul Methodist Church, or please call them on 030-321-1999. This show is supported by the Lady Pharmacist Association of Ghana, LAPAG, and the Young Pharmacist Group. This is also supported by VitC-Fort. It's a sugar-free vitamin C plus zinc supplement from Samu's Pharma. For bulk purchases, contact Samu's Pharma on 050-164-6494. We are taking a quick break. The show continues. Do not go anywhere.
Hospital class, we got Dr. Choma and China.
I got to walk over to New and then we know to teach over black. Dragnet or Dragnet, your online pharmacy. I drove you here beyond, and once I call up, for what I put me to all, they deal on my fee. I never know what like a sales pharmacist, I won't be working for a drove you here. In fact, said you can't come on here. I'm running over past on the castle. Come on, call up. Get you on the fear. Our prescription around. And running out of water. My order, in the next 5 minutes, I'm telling you.
That's it.
Yes, you heard right. With Dragnet, life is now made simple. You too can download the Dragnet app on the Play Store or the App Store and experience a world of convenience. Dragnet, your #1 online pharmacy.
Welcome back. You are watching Ask Your Pharmacist. Today we are coming to you from ICGC Zoe Temple here in Tema Community 5, and we are doing this with the men's ministry. Big thank you to the head pastor, Reverend Kojo Amuasari, and leadership for this great opportunity. So our topic for discussion is the role of diet in lifestyle diseases management. And our guest I have two important people here with me. I have Dr. Marc Dzradosi. He's a pharmacist at the International Maritime Hospital, IMA, and a part of the medical team for the All African Games 2023. And I have with me Mr. Alfred Sackey. He is a registered dietitian at a Shaiman Polyclinic. How are you doing, gentlemen?
Very well, thank you.
I would love for us to go right into action. So I'll start with you, Dr. Marc. What are lifestyle diseases and some examples, please?
Thank you. Lifestyle diseases are basically diseases that we pick up as individuals as a result of our lifestyle or daily habits. And daily habits, I can say that there are positive daily habits and negative daily habits. If you develop a medical condition or a disease from a daily habit or a lifestyle, it's probably the negative ones. So any disease or medical condition that we pick up or that will come into our lives because of our habits and our interaction with our environment, those are what we consider lifestyle diseases. A lot of these diseases will build up over time. They are not things that you start a lifestyle today and then tomorrow you get the medical condition, but they are things that over time, based on how we have lived our life or interacted with our environment, will lead to these diseases. Common examples are hypertension, obesity, cardiovascular disease or heart diseases, lung disease, arthritis, pain syndromes, and many others.
All right, sounds good. All right, to my dietitian, I would love for us to talk about the causes of lifestyle diseases.
Thank you. Well, the causes of lifestyle diseases, they are basically grouped into three main factors. We have the modifiable factors, the non-modifiable factors, and also we have the metabolic factors. Okay. When we talk about the modifiable factors, are the factors that we have control over, the factors that we can do something about. And the first on the list is unhealthy eating. The main reason why we eat is to get energy for our daily activities, to be healthy, to help to repair tissues and worn out cells. That is the main focus of eating. We don't eat to attract any disease condition in our system.
So we don't eat to enjoy it. I like some crispy, fried chips.
It's part of it, but you can still enjoy a meal and still be healthy.
Okay.
A meal can be healthier and yet enjoyable at the same time.
Okay, good.
So with the unhealthy eating lifestyle, one of them like excessive intake of sodium in our diet. Secondly, excessive alcohol intake. Now that has been the norm. Most of the guys, because of stress, they take a lot of alcohol. And according to them, when I take alcohol, I'll forget my challenges. But the alcohol will go off from their face and they come back to reality. Sedentary lifestyle, no exercising, also is a modifiable risk factor. Then let's come to the unmodifiable risk factor. One of them is aging. Also, genetics. Genetically, you can see some family that's a condition like obesity runs through. With that one, there's a little you can do about it. But it's not of the fault of the person being obese, but it's as a result of genetics. And also, we have metabolic factors. With the metabolic factors, we have the high blood level, we have the high glucose level in the blood. All these things are factors that affect lifestyle conditions.
All right, let's take a quick breather. We'll come back and discuss more.
This is Dynamic Salon Bobobo and Culture Group. Keep watching Ask Your Pharmacy.
Welcome back. You are watching Ask Your Pharmacist. Today we are coming to you from the ICGC Zoe Temple at Tema Community 5. We are still discussing the role of diet in lifestyle disease management with Dr. Marc and our lovely dietitian, Mr. Alfred Tawiah. Alrighty, so I would love for us to talk about management of lifestyle diseases. It sounds scary, and I know a lot of our viewers are probably worried that, what they are doing might, lead them to probably having, some kind of complications in the future. But I definitely would love to believe that we can manage it. So I'll start with our dietitian on the non-pharmacological management.
Thank you. With the non-pharmacological management, for the lifestyle conditions, mainly by diet and exercise. So let me talk about the diet. Diet forms an important part in managing lifestyle condition, in that the food that you are eating, one, should be adequate. Adequate in the sense that it should be able to meet your energy needs. You shouldn't eat over or you shouldn't eat less. When you eat over, obesity and overweight sets in. But when you eat...
How would somebody know that they are eating more than they should?
Yes, we have some parameters. We have BMI, which is body mass index, that your weight over height square. So when it's been assessed and you realize that you are within a range of 18.5 to 24.9, it means that you are normal. Above 25 to 29.9, it means that you are overweight. Above 30 to 34.9, it means that you are obese class 1, and so on and so forth. So when we do this assessment and we realize that you are obese or you are overweight, it means that probably you are eating more than you should. Because we should understand that our food intake is dependent on the muscle that we have, our basal metabolism, and our activity factor. So when we are eating more than we are expending, we are going to increase our weight. When the muscle within us is less, definitely our metabolism will go down. So eating more than what you usually use definitely is going to increase your weight. So we need to really take, and I believe most of us has checked our BMI, and now we may know whether we are underweight, normal, overweight, or obese. But when you find yourself within this range, there are a lot of things that you can do. One, you can increase your whole grain intake. In fact, whole grain usually, like the maize, we have maize, the sorghum, the millets, the wheats, the non-refined ones, I should specify, because when they are whole, the presence of the fiber also increases the bulk of the food, and it increases satiety. Once the fiber are there, we tend to chew more, and the more we chew, we increase satiety, and that one helps us a lot. Fiber also helps to eliminate most fat from the system through the digestion process, because we have both soluble and the insoluble fibers. The insoluble fibers really help us increases bowel motility and prevent constipation. And I want to talk about salt, excessive salt intake. Normally, when you take too much salt, it hardens your blood vessels, so the blood isn't able to move freely. By so doing, the heart is forced to pump harder for the blood to move, and that increases the pressure. Ideally, we need about 2,300 milligrams of salt. So let me translate it in a teaspoon. Ideally, every healthy individual need about 1 teaspoon of salt a day. But people with known hypertension needs about 2/3 of a teaspoon a day. So when you are eating more than 1 teaspoon of salt a day, you should understand that you are moving closer to hypertension. The aspect of fats. In fact, we have good fats and we have bad fats. And most of the time, fats from the animal source are bad fats. But that doesn't mean that we shouldn't take them. We can eat them moderately. So with respect to fats, we can equally get good fats from our nuts, from our seeds. And those fats, basically, they are unsaturated. Some are polymonosaturated, and also some contain omega-3 and omega-6 fatty acids, which are equally very good for our heart.
Wow, that sounds really amazing. So let's quickly rush into the pharmacological treatment.
So, since we are talking about lifestyle measures, the key one here is nutrition. And I have to make this broad comment that as a nation, we have to start thinking about healthy lifestyles, healthy eating, and maybe launch a campaign to, as much as we're doing some, we have to go harder at it. Our diets are not the best, and naturally that is what our society is. Almost everything we fry, it's oil-based. In terms of cardiovascular diseases, the main causes are blockages in your blood vessels leading to the heart or the brain or to key organs, including inside your legs. Once you start eating a lot of fatty foods, fried foods, unhealthy foods, the fat portions of meat. I know those days they used to say, yes, papa. The oily part of the meat is the best part, but that is also the one that will kill you. In my line of work, I am a cardiovascular clinical pharmacist. We do plumbing work on the heart, and we've seen people that have come and literally the athletes are more than half blocked or clogged up with fat. So the more fried chicken you are chewing, the more fried fish, the more of the sardinam you are chewing, together with hypertension, together with not exercising, and all the other things that happen, they go inside and they line up inside your arteries and they're sitting there choking, waiting for a heart attack or a stroke. There are lots of other preventive exercise. The American Association, even the Ghana guidelines recommend at least 30 minutes of exercise a day. Brisk walk is okay. If you can jog, even better. But the key thing is avoid the things that will cause the triggers. If you smoke, stop smoking. Another thing, it is not only those who smoke, it is those who are also exposed to the people or close to the people who smoke, called secondhand smoking. So if you live with somebody who smokes, typically or technically you too, you have joined the party. What about people who work in the streets, occupational things? You are inhaling smoke or diesel fumes and all those things, industries, asbestos, the dust and all those things. They all go ahead to cause lung diseases. We need to start finding ways to protect ourselves. So in a nutshell, pharmacological treatment is the treatment with medications. What medicines you use to treat these conditions? Each condition has a different type of therapy for it. Typically, I don't go into details when it comes to this, but if you have hypertension, we will give you blood pressure medicine to take in addition to lifestyle. If you have heart disease, there are different types of heart diseases. Depending on which one you have, you'll be prescribed medicine to take care of it. When we assess your cholesterol, when you determine that your cholesterol is high, typically, depending on the levels, or depending on if you've had another event with it, or what type of medical conditions you have with your high cholesterol, we may prescribe either a 3-month lifestyle modification period for you, or exercise for you, whereby you watch your diet, you exercise, and you do other measures to see if we can lower your cholesterol naturally. So, and that prevents you from taking medications. But if after those 3 months, your cholesterol levels are still high, then we will have to put you on medications to lower them. There are different types of medicines to lower your cholesterol levels based on which numbers are high. So there's high cholesterol, there's total cholesterol, there's LDL, there's HDL. So when we look at all of those, we determine which medicine you have to go on. If it's lung cancer, or hepatitis, or kidney disease, or stroke, all of those have different types of medicines that are prescribed to manage them. Thank you.
So basically our diet is very important. So if you're not taking care of or not eating healthy today, maybe in the future you'll be put on a more stricter diet, which I know we do not want that. Alrighty, so we would open it up to our audience. If anybody has a question for our specialist, I will gladly take it.
Thank you. So all these vitamin supplements that comes in capsules and in all this shape and form, how helpful are they? Because and they're asking us to take supplement because we don't have it in the food.
All right, Dr. Marc.
So, thank you. So his question was, all these vitamins and supplements, are they necessary or how useful are they? We do prescribe vitamins and supplements for patients, but as a pharmacist, we usually will have to assess the patient to make sure, or the person, individual, to make sure that they need these things before we prescribe them. Number one, if your nutrition status is not adequate, or you have certain medical conditions that will benefit from the additional vitamins, minerals, and the supplements, then we prescribe them. There are some people who have a lowered immune system because of a disease condition they have, or medications they are on, or a type of therapy. Such people will have to add on boosters, or immune boosters, or vitamins to help them. There are certain people who, by virtue of their feeding habits, they are not getting the full complement of what they need from their diet to sustain them. So then a vitamin or mineral may be necessary.
My question is more directed to the dietitian. I think generally there's a lot of information about what to do in weight management. There's a lot of information about heart disease. We all know don't eat fried foods and things. But then another section of health is the issue of blood sugar. And sometimes there's very little information on how to manage your diet such that you can lower your blood sugar. Should you have, we all did some health screening. If you realize that your blood sugar had gone up, how can you use diet to bring down and lower your blood sugar? The reason I'm asking is that because usually as men, as you grow up, you don't necessarily eat more sugar by physically putting sugar in your food like children do. But somehow your blood sugar, you go and test and it's gone up. So how can we use diet to lower our blood sugar? Thank you.
Thank you very much. Actually, everything that we eat eventually turns into sugar. Everything that we eat eventually gives us energy. So the more we eat, the more sugar we put into our system. So let's say your body needs about 1,800 kilocalories of energy, and you are taking 2,500. Definitely your sugar level will go up. How will you know that you need just 1,800 kilocalories? There is an assessment that will be done. Your weight will be checked, your height, of course, the BMI will be checked. We'll be checking your body fat, your belly fat, your muscle mass, and based on that, we'll be able to calculate how much calorie you need a day. And when that is given, it will help you to manage your sugar level.
There are folks that do everything right. They exercise, they have enough rest, they eat healthily, they do all things right. But you hear all of a sudden they are dead and gone. What is accounting for this?
So there's something called sudden cardiac death or sudden death. There are times that we may be walking around and everything looks good from the outside. There may be a problem from inside. So typically, if somebody should fall down and die today, it could be due to two things. There are some medical conditions that are silent. An example is hypertension. If you walk around today and your BP is 220/110, there are people walking around like that, and they may be absolutely fine, looking around, walking around, doing everything. But when it gets to the point that this BP has caused a major damage to any of your organs, you could, if medical intervention doesn't come in quickly, you will fall down and die and you're gone. So for people who sometimes just crash like that, there may have been an underlying condition that was not detected. There may be times that there was nothing, but because of something that triggered it quickly, triggered the system and overwhelmed the system, they had to go. So unfortunately, that is what it is.
Today on Dose for Healthy Living, ask your pharmacist. Don't hesitate to ask your pharmacist questions. If you have concerns about your medications, remember your pharmacist is your friend and an important resource for all medication-related questions and concerns.
Okay, so unfortunately, this is where we draw today's curtain on Ask Your Pharmacist. Today we discuss the role of diet in lifestyle disease management with Dr. Marc and our dietitian, Mr. Alfred Tawiah. And today we actually did this with the ICGC Zoe Temple Men's Ministry. A big shout out to them and big thank you to you guys for the opportunity, and to the head pastor, Reverend Kojo Amu Asari. Remember that this show, Ask Your Pharmacist, was proudly brought to you by Dragnet, your #1 online pharmacy. Nansenye chinchin and Pedro, baby, I will be as a Pedra. No person pharmacist kasa me pacho. Adibakwa we here say what download the Dragnet app. Dragnet, your #1 online pharmacy. This was also brought to you by the Pharmaceutical Society of Ghana. Amicus Humani Generis, pharmacists are indeed friends of the human race. This was also brought to you by Letta Pharmaceuticals. Letamin is a multivitamin mineral supplement for total strength and vitality, promotes mental performance, and boosts the immune system. So fab multivitamin ache, like we rightly discussed today, they are very good for you. And if you want the right supplement, please go to any pharmacy near you. Catch your pharmacist and say about the multivitamin supplementer. Near we here a Letamin, Folaron zinc, is a folic acid and zinc supplement that effectively reduces the risk of iron deficiency, supports immunity, and promotes health and wellness. So upa mojedro tatashe, mojedro bebe ni waha nye juma, but upa mojedro pa ko pharmacy. One pharmacist in Casa, the catcher says, Bunny Mojedro dia was only Folaron zinc and Mao. Letamox is a single dose dewormer for treating intestinal worm infection and helps to increase nutritional uptake. Into why analyzing your mother will say no. We do me yache, we push and do me yacha. Sometimes ni area we are in na ye do me na won't do me. Catch your pharmacist and say, Upe, Letamox, Letamin, Folaron zinc, and Letamox are all available nationwide. Any pharmacy near you, go there, talk to the pharmacist, and you can get it. And for bulk purchases, contact Letta Pharmaceuticals on 030-222-4613. Letta Pharmaceuticals, quality healthcare. This was also brought to you by Bell Beverages, refreshing the nation. This was also brought to you by Tema Christian Eye Center. Tema Christian Eye Center is the best and advanced ultra-modern eye care facility with skilled and experienced doctors with exceptional customer service. Into sell pair glasses when you know but the surgery cry anything with the eye. We patch more casa any bebre, Quatema Community 1, Omo Bank, St. Paul Methodist Church, and as a from it was 030-321-1999. This show was also supported by the Lady Pharmacists Association of Ghana, LAPAC, and the Young Pharmacists Group, YPG. This was also supported by Vitc Fort, the best vitamin C plus zinc from Samus Pharma. Please contact them on 0501-646494. Like I always say, whatever that goes in you is merely irreversible. More to the reason, you always have to speak to your pharmacist before you swallow that pill. If you missed any of our episodes, go on YouTube right now at My Pharmacist TV. Like, share, comment, and make sure you subscribe. And if you would like to follow us on all our social media platforms, go on Instagram _ Ask Your Pharmacist. On Facebook, Ask Your Pharmacist. My name is Peggy Sanwo. You can find me on Instagram at Fiery Peggy. I'll be coming your way same time next week. Until then, be safe, be kind, and be healthy. Bye-bye for now.